Many people with pelvic pain will often ask, how did this occur? And oftentimes, it's not a traumatic accident or a weightlifting injury. While it can be, a lot of the times, the daily activities we do day in and day out really do have an impact on our pelvic health. For example, our posture. I'm going to go through some of the simple tips that I give to my patients that can make a really big difference and you can implement right away. For example, sitting slumped over like this puts our pelvis in a posterior tilted position. That's going to change the tension on the pelvic floor muscles. It's also going to cause potentially a lot of pain or irritation, discomfort around your sacrum, maybe your lower back because of the joint positions and the impact on the muscles surrounding. Similarly, if we sit all the way forward, we end up creating too much forward rotation in our pelvis, which creates a C shape in our spine, which is too much extension. Or what a lot of people end up doing, because we know it's important to sit up nice and tall, is they'll just extend to be upright. Ultimately, this is also not sustainable because it's too much muscle tension in your upper back or between your shoulder blades, and there's more of a straightening of the spine occurring. But my pelvis is still in this posterior rotated position. Also, that's a lot of impact on our upper back muscles, and we likely can't sustain this for maybe even longer than a minute, and our body will want to go back into this position. This is really important, let's say from work from home or if you sit at a desk working, so it's really important to get a good ergonomic setup. Instead, you want to think about moving at the base of your pelvis and the rest of the spine will fall in line. All you want to think about is bringing those bony points of your pelvis forward towards your thighs, and you'll notice you just get this nice little roll up. Now, I didn't really do much of anything with my upper back muscles, but now I'm in a good alignment. This can also be uncomfortable to sustain for a significant amount of time, and there are some tools around the house that you can use that can make a difference. One of my favorite things to use is a towel, because everyone has one, and it can be very versatile. Of course, there are different things like lumbar rolls that you can buy, but if you have a towel handy, you can try this out before you decide to buy something more permanent and a bit more spendy. Go ahead and roll the towel up so it's the thickness that you want. That's the other nice thing about the towel, is that you can change the thickness of the support system, whereas the standard lumbar rolls can be really thick and push you really far forward. So you can change the towel roll to your liking. You can do a few different things. You can put it behind your lower back so that you have a nice cushion. Some work chairs or ergonomic chairs already have this built in. But if not, for example, in this chair, this is an easy fix and you can lean against it without compromising your pelvis and not rolling into that posterior pelvic tilt. I actually prefer more of the support in my kind of mid to upper back. I can still use this towel, but this time I'm going to put it long ways. Go ahead and put your hips all the way back in the seat, bring the towel roll kind of mid back, and now you have support between your shoulder blades and you can still lean back. You have a nice little gap in your lower back, keeping that nice curve, and my pelvis is still in that more neutral position and not tilted